But again, this is us doing our part on being the experts in Medicare, and then we rely on you to educate us on how you use your health insurance. The hours of operation we have are 8 in the morning to 9 p.m. That's Eastern Time. That is Monday through Friday. What will happen is if you decide to make this transition, well, first call that phone number that we provided earlier, that 855 number. Call your benefit advisor, give them your prescription drug information, educate them on how you use your insurance, and then set up an enrollment call. On your enrollment call, the benefit advisor will set apart about an hour, plan for about 1 hour per person. It can take less time, it can take more time, it just depends. So typically we say just an hour. On that enrollment call, the benefit advisor will do the needs analysis. They will ask you some questions. They'll find out a little bit more in depth on how you're using your insurance. Once they find out how you're using your insurance, they will help you make a selection. The benefit advisor is not going to throw 30 different plans at you and tell you to select one. They're going to help narrow it down to maybe 2, maybe 3 plans, and then you select one of those plans, and those will be plans that will fit you better out of the plans that are available. Now, if you do that enrollment call with the benefit advisor and you don't feel comfortable having just being one-on-one with that benefit advisor, that is okay. You can have a friend, a neighbor, a relative, an attorney. You can have your garbage man on the phone if you like. Just make sure if you have someone else joining you on that phone call, you do let the benefit advisor know, and that you also give the benefit advisor permission to talk to that other person about your information. It may be that you have a son or daughter or relative in a different state that you would like to have join this phone call with you. Well, if that's the case, I've done it plenty of times, a 3-way teleconference. I had a retiree who was a mother, and she wanted her daughter to join us on the teleconference on the enrollment call. So the mother gave me the daughter's phone number. I called the daughter who was out of state. I put the daughter on hold. I called her mother who was the retiree. I merged the phone lines, and I had all 3 of us together on that phone call so the mother could make the choice and the daughter could listen and help out. So we can definitely accommodate that as well. Now, when it comes time to make that plan choice, all the enrollments are done over the telephone. So all the appointments, all the enrollments are done on the telephone with the benefit advisor. When you do decide to go with the plan, the benefit advisor will fill out what's known as an electronic application. On the computer screen of the benefit advisor, they will have the electronic application, and once you make the plan selection, they will fill that out with you on the telephone. They will also need to get what's known as a voice signature. What will happen is once you make the plan selection, the benefit advisor will play what's known as a recording. We refer to it as a disclaimer. You'll listen to the recording, which will go over the terms and conditions of the plan that you selected. And at the end of that recording, the benefit advisor will ask you to state your name, the date, and if you agree. And by stating that information, that counts as a voice signature, which allows the benefit advisor to send that electronic application directly to the insurance carrier. So all the calls are done over the phone. All the applications are submitted electronically. It keeps it seamless. It gets done very quick, and we actually get an application ID number, which allows us to track those applications and know where they are so they're not falling between the cracks. Also, 100% of the calls are recorded, and that's for your protection as well as for our protection. When you do talk to your benefit advisor, I would recommend having your Medicare card, that red, white, and blue card. We need to make sure we have your Medicare claim number, your Part A and your Part B effective date, and we also need to make sure we have your name on your Medicare card. I would highly encourage you to have this card or at least the information on the phone call with your benefit advisor. The reason is because they have to match identically. If your name is William, but you go by Bill, and we put Bill on that electronic application, but it says William on your Medicare card, when that application goes under review and it doesn't match up with your Medicare card, then it gets sent right back to us and we have to resubmit that application. So please just make sure you have your Medicare card or at least the Medicare information on that phone call. If you by chance don't have your Medicare card, that is okay. You can call Social Security, you can go to your local Social Security office, or you can call Extend Health and talk to a benefit advisor, and we can help you walk through that process of getting that information from Social Security. Now, I'd like to go over some of the plans that I quoted I quoted some in the DC area, and then I also quoted some in the Arlington area, just so everyone has a point of reference. But please keep in mind these plans and these rates I'm about to show, these are 2012 rates. They are not updated for 2013. And again, those have not yet been released, but they will be soon. But these are just 2012, which means they will change for 2013. So what I found is in the the county of DC, I found there were 2 Medicare Advantage plans, and the premium range was $55 to $115. That is per month per person. The Medigap plans, there were 14 different plans in the area, and that premium range is $72 to $216. This is per month per individual. And the Part D drug plan ranged in price from $15 to $110. This is per month per person. So that is a lot of different plan selection. That is 32 different plans in the county of DC area. How are you to know which of those plans is a better plan for you? Do you know how I know it's Medicare time? When I go to my grandfather's house, I'll look on his desk, and he has a stack of mail that's 4 feet tall, and it's all information from insurance carriers telling him it's time to enroll in their Medicare plan. And they all state that they have the better Medicare plan for him. But how do they know they have the best plan for him without talking to him, without knowing his prescriptions, or how often he goes to the doctor? That is why you have your benefit advisor. Your benefit advisor will be very familiar with the plans and service in your area, and once they know how you use your insurance, they can help you find the plan that fits you best as an individual. So it very well could turn out that Mr. Jones goes with one plan and Mrs. Jones may select a completely different plan. It just depends on how you use your insurance. There's also some ancillary products. There's a vision plan offered through VSP. They charged in 2012 as $14 per month for a year of service, which came out to $168 for the full year. They did require that payment at the beginning of the year. Again, that will change for 2013. There are 2 dental options. Those are from Delta Dental and Humana, and they range in price from $23 to $48, and that is per month and per person. Now I'd like to compare a Medicare Advantage to a Medigap. And again, please keep in mind these are 2012 plans and these are 2012 benefits. So here I'm quoting a Medicare Advantage plan. We know it's a Medicare Advantage because it's an HMO. Now remember, with an HMO, I have an in-network benefit only. I cannot go outside of that network. With this HMO, I pay a $10 copay for my primary doctor, and then I pay a $40 copay for my specialist. If I go to the hospital, I pay $250 a day each day I'm in the hospital for the first 7 days. After that, after the 7th day, it's $0 copays for days 8 through day 90. Now remember, Medicare Advantage will have your Part D drug plan built into it, so you have your medical and your prescription coupled together with one plan, one premium. So if you're looking at the screen, it says RX. RX is your Part D drug plan. You'll see 7, 33, 45, 95, and then 33%. The $7 copay and the $33 copay, those are for your generics and your non-preferred generics. The brand, the $45 copay, is for a 30-day supply of your brand. The $95 that you see is for a 30-day supply of your non-preferred brand, and the 33% you see is for your specialty drugs, which are compounds that are mixed at specialty pharmacies. So whatever prescription that you are taking will fall into one of those tiers, and in this case, with this plan, you would pay that copay based off of what prescription is, if it's a generic brand or non-preferred brand. But again, all of the drug plans will probably be a little bit different. Now the other option we have is the Medigap. Remember, the Medigap plan is categorized by letters A through N. In this case, I'm quoting the plan F. F is in Frank. This is considered the Cadillac of the Medigap plans. Remember, each letter offers a different level of coverage, and this is the higher level of coverage that are offered by Medigap. With this Medigap plan F, you can see any doctor anywhere in the country as long as that doctor accepts Medicare. You can go to any hospital anywhere in the country as long as that hospital accepts Medicare. About 96% of doctors accept Medicare. With the Medigap plan, you will typically have a higher premium, so you pay more to have the service, but in this case, when something does occur, you pay zero out-of-pocket expenses. What's your copay when you go to the hospital? Well, with this plan, it's a $0 copay. What about when you go to your primary doctor? It's the same, it's a $0 copay. Remember that previous plan I just showed you, you had to pay $250 a day each day in the hospital. With this Medigap plan, you pay $0 when you go into the hospital. Now, with this Medigap plan, I quoted a 75-year-old male because Medigap plans are based off of age and where you live. With the Medigap plan, remember, it does not have a drug plan built into it, but if you are looking at the screen, you'll see RX at the bottom. The RX is your drug plan. I had to get a separate drug plan to go with this. So I quoted a drug plan. It was $8 for a 30-day supply of my generic. It was $43 for a 30-day supply of my brand, and $95 for a 30-day supply of my non-preferred brand, and 33% coinsurance for all my specialty drugs. Now let me point out, if you do go to your local pharmacy and you order 30 days, or maybe you order a 90-day mail order, or maybe you go to your local pharmacy and order 90 days. Some of those pharmacies allow that. If you have a specific pharmacy that you prefer to go to, let your benefit advisor know. That way they can find a Part D drug plan that allows you to still go to that same pharmacy. If you prefer to do 30-day local or 90-day mail order or 90-day local, let your benefit advisor know. Educate us so that way the benefit advisor can find that plan that fits your needs the best. Now I'd like to go over the Arlington, Virginia plans. Please keep in mind as well that these are 2012 plans. 2013 as of today rates have not yet been released. So in the Arlington, Virginia area, there were 5 Medicare Advantage plans. They range in price from $0 to $128 per month and per person. The Medigap plans are 17 different options, and those range from $66 to $390 per month per person. And the Part D was 20 plans, $15 to $119 per month per person. It has the same dental and vision options as the other areas, so it's 1 vision plan from BSP and 2 dental plans, one from Delta Dental and the other through Humana. Now, in the Arlington, Virginia area, I quoted a PPO. With the PPO, you can go to doctors in-network. You can see doctors out of your network. You pay a higher copay, a higher fee to see doctors out of the area. Again, you pay to have that flexibility. With this plan, it's $15 to see my primary doctor. It's $35 for the specialist. The hospital copay for this is the same as the other Medicare Advantage plan I just showed you. It's $250 a day. Each day I'm in the hospital for the first 7 days. Days 8 through day 90, it's a $0 copay. Remember, the Part D drug plan is built into the Medicare Advantage. So in this case, it's $8 for my generic, $45 for my brand, $80 for my non-preferred brand, and 33% for my specialty drugs. And then I also quoted a Medigap plan. I quoted the Plan F for the Arlington area. And a Plan F is a Plan F is a Plan F, which means a Plan F will be identical in benefits no matter what area you go to and no matter what company you go to.